Hi, I'm Dr. Ann Korkidakis. I'm a fertility specialist at Boston IVF. I work primarily out of the Waltham and Worcester offices. I was hoping to spend some time today to speak about the effects of advancing age on fertility. So, there's no universal definition of advanced reproductive age in individuals with testes, although we do see some physiologic changes over time. The most marked endocrine change is a reduction in testosterone levels, and this can cause issues with libido and fatigue that can translate to sexual dysfunction. We also see lower semen volumes and effects on the motility with advancing age. The effects of advancing age on individuals with ovaries are more pronounced. Individuals with ovaries actually have the highest amount of eggs when they're in utero. When they're born, the number is already decreased from 7 million to 1 million. Once puberty starts, there's a cohort of eggs that develops each month. One is ovulated and the others undergo atrophy. Essentially, they die off. So we do see a marked decrease in egg number over time. The other aspect of the ovaries that's impacted is egg quality. Starting at approximately age 35, and it's even more pronounced at 40, there's a decline in egg quality, meaning there's a higher proportion of eggs that have missing or extra chromosomes. This decreases their implantation potential and increases the risk of miscarriage. Now, we do have the ability to test for ovarian reserve, which reflects the egg quantity through both blood work and ultrasound. Unfortunately, at this time, we don't have the ability to determine egg quality. We primarily relate that to an individual's age. The ovarian reserve testing informs us once again on egg quantity. Is not reflective of egg quality. And in fact, treatments such as IVF can be very helpful in individuals with ovaries, even with a diminished ovarian reserve. In terms of egg quality, that's mainly determined by an individual's age. To optimize quality, it's important to maintain a healthy lifestyle, avoiding significant alcohol use or cigarette smoking, and continuing with prenatal vitamins. If you're under 35 years old and have been trying to conceive for a year, or if you're over 35 and been trying to conceive for 6 months, I would encourage you to speak to a fertility specialist about initiating testing. We're always also happy to meet with individuals who are not actively trying to conceive, but want to find more about their fertility potential and options to build their families. More and more individuals with ovaries are considering forms of fertility preservation, such as egg freezing. It's important to know that the potential of these frozen eggs are related to the number of eggs we have, as well as the age at the time of egg freezing. It is therefore very reasonable to consider fertility preservation at a younger age when we anticipate the best quantity and quality of oocytes. We're always here to answer your questions on fertility and options to help build your family.